And now joining me once again on our show is Dr. Mark Cameron. He's an immunologist who is set up in the States, but actually a Canadian from across the border. And Mark, always appreciate you taking the time to give some insight on what's happening with the COVID-19 situation. Now, wanted to talk about how we're currently obviously in the second wave here, right up at the top, possibly going higher. First of all, I just wanted to ask you about this vaccine situation. So we've heard that Pfizer and another company have sort of reached this 95% in the third round of testing, and you know, headlines saying, oh, you know, the end of the year or into January, possibly seeing vaccines coming out. What is the realistic scenario here, Mark, aside from what the news is pushing forward right now?
Right, so this is very good news. These vaccines have been developed very quickly. And I think the last time we talked, I was really curious about when the first set of results were going to be released. It was hopeful by mid-fall, and here we are in mid-fall, and these results are starting to come in. And three different vaccine platforms have released their findings. The two mRNA vaccines are well over 90% effective. And a third one today, the AstraZeneca vaccine, has come in at an average of around 70% effective. So this is very good news in terms of the development phase of these vaccines. Now, it's early data. We'll be taking a very close look at it. But the next step for these vaccines is to get them into emergency use here in the US. That's done through the FDA. And what that does is allow the vaccine companies to get it out to high risk and vulnerable populations to enter the next step, including healthcare workers, maybe patients in long-term care facilities. Now, in terms of the rest of us and when we could expect to have our own vaccine, this puts us on track. I would say in the second quarter, some of us will have access to this vaccine. The challenge now is to get it manufactured, roll it out to the public, get all of the data into our healthcare providers' hands, into our hands, to judge which vaccine may be the most effective, which vaccine we could be taking, depending on how old we are or where we live in the country. But we are now looking at 2021 for the vaccine to be rolled out to the general population. And that was, at doubt, even a matter of 30 days ago. So this is good news, and it's on track.
Mark, what's the realistic scenario that this is going to, you know, quote unquote, fix the problem that some people believe, you know, this is going to happen?
Right. So when the vaccine comes out, it's not going to have an overnight effect on the spread of the virus. There still has to be a period of time where we get our vaccine. We will still have to take these precautions. It won't be an overnight or even a 30-day or 60-day impact. We're going to be living with this virus well through 2021. What is hoped is during that period with the vaccine, and hopefully as we learn more about therapies, and hopefully as we learn more and more about controlling the transmission spread, that we will be at least able to target people who are vulnerable to the infection, like older individuals or healthcare workers, and start at least breaking some of those transmission chains to bring the numbers back under control. As they are not right now in terms of the exponential spread of this virus, which is leading to this lockdown situation and additional limitations on our day-to-day activities as we enter the holiday season in a month's time.
Mark, just in terms of, you know, we're having an issue with flu shots in Ontario right now in terms of, you know, there's just an overall want to have that. Are we going to see a similar scenario with the COVID-19 vaccine of maybe a shortage situation until, you know, more vaccinations can be made over time?
Yeah, so this will impact the COVID-19 vaccine as well. These are brand new platforms. They have very specific means of preserving them and distributing them to your local doctor or a vaccine clinic. One of the vaccine platforms needs it to be transported on dry ice. All of these factor in to how quickly the vaccine can be distributed across a country like Canada with a variety of different cities and population densities and challenges to get the vaccine there. So the flu side, is really about the number of people that take the vaccine. Most people do take a flu vaccine, so the shortage is a result of its success. People take the vaccine, so it has to be there in enough numbers and last throughout the season to get it out to everybody in the country. The good news about the coronavirus vaccine, despite it being this kind of first rollout, and there will be challenges for sure, is that countries are paying very close attention to the demand. There are millions and millions of doses being ordered, and provided those can get out to the general population, I think you're going to see the availability of the vaccine to be very high. This is an extraordinarily important program to get these vaccines out, and it really is a matter of life and death right now, given the amount of COVID-19 spread. There will be hard decisions. We will have to look very closely at it, but I think the vaccine will be in people's hands as quickly as it's available.
So, Mark, just moving away from the vaccine talk right now, let's talk about Christmas, because that's a question that's in everyone's mind right now, big question mark on how it should look this year. I know, including with my family, there's discussions about maybe taking a pass this year. So is that something families should be considering? Because, again, we're not going to see this vaccine until probably early 2021, right?
Yeah, that's right. So entering the holiday season here, for me, I understand people's disappointment. I'm disappointed myself that as we get to the end of the year here and the traditional things that we do around the holidays, families getting together, even something like, carolers singing, choirs, church congregations, all of those things are going to be very, very badly impacted by COVID-19. This peak that we're on right now that correlates with the cold and flu season, it's going to be with us throughout the holidays. And in fact, as we may or may not let our guard down in terms of family get-togethers and parties and social events, I'm sure we will see a bump after Christmas or the holidays of new cases, just like Canada saw after Thanksgiving weekend in October. So right now, since the virus is even more present in the population in Canada as it was back in September, we have to be very diligent. We have to protect the most vulnerable in our society, our elderly parents, our grandparents, people with other conditions that make them susceptible to severe COVID-19 illness. Our holidays will look a lot different. So what I would encourage people to do is to listen to their local health departments, listen to the public health leadership in our government, get those recommendations about how to limit infections as we enter this season. And really, for most people, it's going to be hang out with your immediate family, hang out with the bubble that you have created so far as you live through this pandemic, whether that's roommates or friends or partners or spouses or families. Travel is going to be limited. Gatherings will be limited. All of the things that we know now will cause cases are going to be off the table. So plan for a very quiet holiday season amongst the family members or friends or roommates that you've been, living through the pandemic so far. It's interesting you talk about testing, because as our college age kids come home, our houses are going to get that much bigger for those with kids away at school. A test, I hope, is possible before they come home. Some campuses are offering that. If you can get tested in your household, either the son or daughter coming home or as a family unit as they come home. If you can get a test, that would be a very good idea, because then we know that, okay, if everybody's negative, we're reestablishing our bubble with our son or daughter back from university, and we can proceed safely as that unit.
All right. Dr. Mark Cameron, really appreciate your insight once again on the COVID-19 situation. I'm sure we'll be talking to you again soon. Thank you so much. And if I don't talk to you, have a very Merry Christmas yourself.
You too, and thanks for having me.